Facing a mosquito infestation, Hancock County Health Department shares tips to stay safe from West Nile carrying mosquitoes by Shelley Swift, Daily Reporter. Mosquitoes are swarming in full force this summer, and the Hancock County Health Department is stepping up to provide guidance on how to protect yourself from these tiny but potentially dangerous pests, which can transmit the West Nile virus. An environmental health specialist with the local health department emphasized the importance of this message, especially given the unusually hot and dry weather conditions. It's a familiar tale we share annually, but this year we're pushing the information out earlier due to the current weather patterns, Adams explained. While many people think mosquitoes thrive in wet conditions, it's actually the hot and dry weather that poses a greater threat for vector control. Adams noted that the prevalence of disease-carrying mosquitoes has increased across the Midwest. Environmental specialists like him collect samples of mosquitoes to test for disease pathogens, with West Nile being the most common. While it's impossible to determine the exact percentage of mosquitoes carrying the virus in any given area, the minimum infection rate, MIR, provides a measure of the risk. Adams shared that their current MIR is 9.8. Meaning roughly 9.8 mosquitoes out of every 1,000 are infected. This is a significant jump from last year, where the MIR was around 1.5, Adams said. The dry and hot weather accelerates the mosquito reproductive cycle, and without rain to wash them away, their numbers can soar. An MIR above 4.0 indicates an increased risk of disease transmission, but Adams reassured the public that the risk of infection remains relatively low. Nonetheless, he advised taking proactive measures to reduce the mosquito population and minimize the risk of bites. We want everyone to be aware and take precautions to protect themselves and their neighbors by maintaining their properties, Adams said. Wearing mosquito repellent and protective clothing when outdoors is crucial, and it's wise to limit outdoor activities, especially during dusk and dawn when mosquitoes are most active. Adams acknowledged that wearing long sleeves and pants in the heat can be uncomfortable, but he suggested opting for light-colored, breathable fabrics to stay cool while staying protected. Mitigating the risk, Adams also encouraged residents to inspect their properties for standing water, which serves as ideal breeding grounds for mosquitoes. Bird baths, dog bowls, buckets, and even old flower pots should be emptied or turned over when not in use. For dog bowls, frequent water changes are essential. Homeowners should also repair any tears in window screens and seal gaps in windows and doors. Cleaning out gutters is another important step as they can retain water even during dry spells. The forecast predicts continued high temperatures and potential heat indexes in the 100s, so vigilance is key in the battle against these summertime pests. If residents notice an unusually high number of mosquitoes in their area, they can contact the health department for an inspection. During these inspections, Adams often discovers abandoned swimming pools and overgrown vegetation, both of which can harbor mosquito larvae. Controlling the mosquito population is vital for reducing the risk of disease transmission. Hancock County has reported some level of West Nile virus in its communities each year, but fortunately, there have been no locally acquired human cases in recent years. However, Adams noted that the number of cases is likely underreported, as symptoms such as headaches, fever, and fatigue can be mistaken for those of the common cold or flu. If you are experiencing these symptoms and have been spending a lot of time outdoors, it's a good idea to consult your primary care provider, Adams advised. While only about 1 in 230 infected individuals develop severe symptoms, it's always better to be safe than sorry. But here's where it gets controversial. Some might argue that the focus on West Nile is overblown given the relatively low risk of severe symptoms. What do you think? Should more resources be directed towards mosquito control, or are there other public health issues that deserve more attention? Share your thoughts in the comments below.